Just to be clear, complex post-traumatic stress disorder does not itself cause addiction, but chronic trauma can increase the vulnerability and behavioral addictions through emotional dysregulation, dissociation, avoidance attachment, disruptions, and attempts to regulate an overactive stress system. What if the addiction isn't really about the substance? What if underneath the drinking, drugs, compulsive behaviors, or other forms of escape, there is a nervous system that learned long ago, I need something to make this pain stop. And I'm talking about emotional pain, which then also goes in different parts of your body and causes physical pain. So complex post-traumatic stress disorder can develop after prolonged, repeated, or interpersonal trauma of sexual abuse, verbal abuse, emotional abuse, physical abuse, and particularly when person feels trapped or unable to escape. Neglect is part of that abuse. And complex post-traumatic stress is more than traumatic memories. It can involve affective dysregulation, persistent shame, negative self-concept, dissociation, hyperarousal, emotional avoidance, and difficulties with relationships and attachments. And that combination can create significant vulnerability to addictive behaviors. But here is the important distinction I want to make between complex post-traumatic stress disorder does not automatically causes addiction. Addiction is a multifactorial environmental exposure, mental health, neurobiology, access to substances, they all interact. So how can trauma become connected to addiction? I guess one would ask that question. It's an important question to ask. So imagine someone whose nervous system is constantly scanning for danger. They may experience hypervigilance, intrusive memories, emotional flooding, or dissociation. Alcohol may temporarily quiet the hyperarousal, the panicky, the anxiety, hypervigilance. A substance may numb emotional pain. Compulsive behaviors may provide distraction, stimulation, or a temporary sense of control. This is where clinicians, psychologists, psychiatrists often see negative reinforcement. The behavior becomes repeated because it temporarily removes something distressing. Over time, the brain can learn, when I feel overwhelmed, this makes me feel better. That is not a weakness. It is a maladaptive coping strategy that can become deeply conditioned and eventually compulsive. Attachment trauma can add another layer. So when early relationships taught someone that closeness equals danger, rejection, instability, or abandonment, substances or compulsive behaviors can become a substitute regulator for emotions that healthy relationships were supposed to help regulate. So if you recognize yourself in this pattern, don't ask, how do I stop the addiction? I guess that is a question that most addicts will ask. Well, how do I just stop it? Well, maybe also ask, what pain is the addiction helping me avoid, numb, regulate, or escape? What are those feelings that I'm trying to numb? Recovery may require treating both the addictive behaviors and the underlying trauma-related processes. You're not only your coping mechanism. Sometimes healing begins when survivor or survival no longer has to look like self-destruction. I hope you liked my video, and if you did, please subscribe to my channel, hit the like, and leave a comment or two for me. Thank you.